From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon. Welcome to 22 News in Focus. I'm Kate Walsh. On today's program, we'll be addressing two important health issues: premature births and Alzheimer's disease. November is Prematurity Awareness Month and National Alzheimer's Disease Awareness Month. These health issues affect some of the most vulnerable people in our society, infants and the elderly. We'll be talking about the progress that modern medicine is making and the support systems available for patients and caretakers. So first, we'll begin with the topic of premature births. And joining us today are Christina Gable, Maternal and Child Health Director for the Massachusetts March of Dimes, and Dr. Jeffrey Schenberger, the Chief of Newborn Medicine at Bay State Children's Hospital. Thank you so much for both being here with us today.
Thank you.
First, before we get into the details, can you give us some background on your experience in this field? You can start.
Yeah, so I work with the March of Dimes here in Massachusetts, and in 2003, the March of Dimes launched the Prematurity Prevention Campaign. And that's a campaign that runs across the nation, and we're working hard here in Massachusetts to lower prematurity rates as well as nationwide. And
your experience in the hospital setting,
Sure.
of course.
I've been working in newborn medicine or neonatology for the past 22 years at 4 different centers across the eastern coast of the United States, and have participated in the care of several hundred to thousands of babies over that time course.
To me, and of course others, it's incredible to see how young a baby can be born and still survive. It's incredible what both of your efforts do in saving so many lives, so little too, and so premature. So that's how I want to start things. How many weeks can a baby be born and still survive?
Well, the earliest that there are a few babies surviving is in the latter half of 22 weeks of gestation, 40 weeks being it. But it's still at that stage, it's extremely unusual, and most of the babies at that point that do survive have significant challenges, both in breathing and probably neurodevelopment and so forth. Until we get into the 23 weeks and 24 weeks, the survival exceeds about 50% or greater. And more than half of those babies are doing reasonably well by the time they're discharged from the hospital.
Wow. And for a 22-week-old or gestation of 22-week baby, how much do they weigh when they're born?
Well, that they can weigh as little as 400 grams or 10 to 11 ounces at the absolute smallest. But again, the babies that are the smallest are also a technical challenge because we don't always have equipment that is small enough to actually treat them, to be able to put them on respirators and so forth. So until the babies get closer to at least a pound, sometimes a little bit larger than that, is where we get to the point where all the instruments and so forth that we have are able to maximize their chances for survival.
It's incredible. What are some of the causes of premature birth? Could you talk about that?
Yeah, so I want to start out by saying that a lot of times we don't know why premature birth happens. A mother could be perfectly happy and healthy throughout her pregnancy and then one day go into preterm labor. But there are some modifiable risk factors, such as staying away from smoking, obviously drugs and alcohol. Other risk factors might be familial history, so having a history of preterm birth, having a personal history of preterm birth in a prior pregnancy. Those could be some risk factors, including also having multiples.
Wow. Yeah. Do you see a lot of twins and triplets born very early?
We do see, for some of the babies, twins, occasionally you will get them out to 38 to 40 weeks where you would like to see them, but more commonly it's in the 34 to 36 range, just a little bit premature. When you get up into infants that are born, triplets or greater multiples, once you get beyond 30 weeks is where you really start to see the increased risk of delivery. Just recently we've had 2 sets of triplets that were born at Bay State, and they've been ranging from 33 to 35 weeks.
Okay. So talk us through the process of when a baby is born extremely prematurely. The mother either gives birth or you have to have a C-section, emergency C-section. Then what happens with the baby?
Great. There's an entire team that will be there. It encompasses usually a neonatal nurse practitioner or neonatal physician's assistant, a neonatologist like myself, respiratory therapists, oftentimes at least one nurse from the newborn intensive care unit and another nurse from the or two from the labor and delivery service. All those folks helping to stabilize the baby and make sure that they stay warm, get dried, get the respiratory support that they might need in the immediate time frame after delivery, and get stabilized enough so that we can bring them over to the newborn intensive care unit.
What are some of the most immediate concerns? Breathing problems and warmth?
Breathing problems and warmth are universal, especially at the early stages and the more premature infants. And the respiratory support can be a matter of supplying a little bit of oxygen, supplying some oxygen that's under some pressure to help keep their lungs inflated, or putting a breathing tube down and putting them on a respirator at that time. As far as addressing their temperature support, usually what we do with the small babies is they don't have very much fat tissue, so they lose heat very, very quickly. And of course, they're wet when they come out. So drying them off, we initially put them into a small plastic bag to actually keep some of that moisture and heat in while we're maintaining the airway and getting them settled.
And would either of you be able to talk about the mother after that process? You know, obviously it's devastating. It's a lot of fear going into that, especially if it's in the 22-week to 30-week range where there might be a high mortality rate still for the baby. So what does the mother then have to go through after that?
So I think there's some immediate emotional challenges, such as most mothers, you know, when they think about their labor and delivery, think, I'm going to immediately have my baby in my arms, and then we're going to spend hours together after that, and we're going to establish breastfeeding and so on. But a lot of mothers really struggle with that. The first thing they might not be doing is spending time with their infant, and instead having to go to the NICU. Some of these moms might have known in advance that they were at risk of preterm birth, or they might have been hospitalized, hopefully waiting as long as they could to go into labor. So I would say the emotional aspect of this can start far beyond birth, and certainly right after birth, and those critical hours right after delivery, a mom goes through a lot of emotions.
Yeah. And then once the baby is stabilized right after birth, what's the process like for the weeks leading up to, let's say, 40 weeks when it's, you know, normal, so to speak?
Well, the parents are always actively involved in their care. So one of the things that we establish, and if we can meet with the mother before they actually deliver, is tell them that the most important thing is ongoing dialogue, and even perhaps even in the delivery room, because if you get to those babies that are on the borderlines of viability, and that would certainly be all the 22-weekers, possibly a lot of the 23-weekers as well, is you want to let them know how things are going, because as you mentioned before, the mortality risk for those babies, even in the immediate minutes to hours after birth, is quite high. And so you want the parents to be actively involved with the decision making, the knowledge of what's going on, and that continues once the babies are up in the newborn intensive care unit. We need to keep them involved with what procedures are needed to be done, what tests are showing, and how the baby's doing overall. And parents are very vulnerable at this stage because they really have a feeling of helplessness, as the things I can't do that I would normally be doing for the baby. So you have to kind of draw them in to make them an active participation in the care for their child.
That must be difficult. It takes a special person to be in the NICU. I hear all the time that the nurses are really special people in there. Can you talk about that? I mean, obviously you're a special person too as a doctor, but what is it like to be a NICU nurse? Could you explain what they have to do?
Well, I think these nurses, I mean, have the challenge of trying to develop a deep and quick personal relationship with all the parents that they meet. And it can seem quite foreign to the parents. I mean, they're in a totally different environment. There's a lot of big words being thrown around. There's a lot of equipment and sounds and just things that they're not used to. But I will say, from the March of Dimes perspective, we usually only encounter exemplary, outstanding nurses. And we actually have a Nurse of the Year award that's coming up in December, where we give awards and recognize roughly like 30 to 40 nurses who have just gone above and beyond. And these nurses are people who not only care for families and babies, but they co-support the staff who might also be having a really hard time, especially if there might be something like an infant loss. So we really want to give hats off to all the emotional, physical, and medical support that these nurses give.
Yeah, it's incredible stuff. So I want to get back to the babies. After they're born, do you make sure that they're stable, and do they kind of keep growing on their own, or do you have to do certain things and give them like feeding tubes or whatever to replicate a placenta?
If they're very premature, certainly, and that can vary from saying that they're 26 weeks or less, or sometimes depending on how their lungs are progressing, it can be 30 weeks or less. Oftentimes they'll be started on IV nutrition before they get anything as far as milk or formula into their belly. And that can go on for several days to even several weeks, where they'll be getting protein, sugar, and fat through the IV route, enough that they can grow. They, of course, need to have catheters in of some sort to be able to get that nutrition, which creates its own challenges, particularly for the smallest ones. But thereafter, we get them onto, mother's milk is a preferred thing. So if we can get as many mothers breastfeeding and sustain that, that's the absolute best thing for the babies. The easiest to digest, gives them protective factors to fight off infection. And we get them established with that as soon as we can. We'll be supplying even colostrum, those first couple drops of breast milk, even to their mouth within the first day for the babies. But nutrition, all the babies need to get bigger, and what I always tell mothers is the cure of getting out of the newborn intensive care unit is to grow and get bigger. And that's kind of the answer to pretty much everything as far as getting home.
All right, excellent. So we're just going to take a quick break, and we'll be back talking about premature births. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about premature baby health and wellness issues, and continuing our conversation with Christina Gable, Maternal and Child Health Director for the Massachusetts March of Dimes, and Dr. Jeffrey Schenberger, Chief of Newborn Medicine at Bay State Children's Hospital. We were talking about preemies and some of the possible ways to prevent premature birth, although you can't always do that. But let's talk specifically about Springfield for a second. You work in Springfield and you look at the research there. What can you tell us about that? You were talking a little bit about it during the break.
Yeah, so definitely when we were talking earlier about how we can avoid preterm birth, one thing that we encourage mothers to do is to take care of their chronic conditions. And we have a high rate of diabetes in this area. We also want them to help take care of issues like hypertension, talk with their doctor. And also in Western Massachusetts, we're seeing rates of women who have inadequate prenatal care. It doesn't necessarily mean the quality of care, but it might mean that they enter prenatal care 5 months and later, or attend less than 50% of their prenatal visits. So that's about 13% in this area. So about 13% of mothers are not getting the adequate prenatal care that they need. So
not an ultrasound, nothing like that until 5 months?
They might receive some of that care, but yes, it's late, much later than we would like.
So they wouldn't even know if there were a problem if there weren't obvious signs for their pregnancy.
Right, they might know about some crucial problems that can occur early on.
Wow, that's interesting. And are there anything specific with babies in Western Massachusetts that you might see on your end?
No, I don't think there's anything specific to Western Massachusetts. We certainly see in a number of the babies, whether they be premature infants or term infants, the impact of poorly controlled diabetes. In other words, the mother's sugars tend to be high, but the inverse happens to the babies. The baby's sugars tend to be low. And so even if they're eating adequately, sometimes have to put those babies on IV glucose to make sure that they can keep their sugars up until their body gets used to adjusting to a new environment outside of the womb.
And we're talking, unfortunately, a lot in Western Massachusetts lately about the opioid crisis. Do you see a lot of babies born addicted?
Well, the babies are, they're certainly exposed in utero to this. And premature babies, in general, have much less of a problem of showing signs of withdrawal than the term babies. And that's related to multiple different factors. So when we're talking about premature birth, we don't tend to see all that much incidence of withdrawal until perhaps about 34 weeks. But for term infants, we do see it, and we do have a large number here in Springfield. We see approximately 100 babies to 110 babies a year that need treatment for opiate withdrawal in our center.
And I also want to say that the March of Dimes is definitely concerned about the use of opioids in Massachusetts. We actually advocated in the state legislature last year to have $100,000 allocated towards neonatal abstinence syndrome, because we need good data on this issue. If we want to start to try to solve this growing problem, we need to know where these cases are occurring. And a lot of these babies are very kind of agitated when they're born, and a lot of them sometimes will have special conditions in the NICU, such as low lighting, lots of holding, you know, being in rockers that have movement. So we're trying everything we can to abate this problem.
And does Bay State have a program where volunteers come in and hold the premature
They do. The
babies?
cuddler program, yes we do. We never seem to have enough of the folks, so if anybody wants
Really?
to join in, we
I'm
can certainly
surprised.
help. And these babies in particular, the babies that have withdrawal symptoms, really even require more of that. What we call the non-pharmacologic treatment methods, which is a lot of what we would normally think of holding a baby, rocking a baby, swaddling them, and those sorts of things are things that soothe the baby and can get them either through the process without needing medication or reducing the amount of medication that they might need.
Very interesting. How about the long-term effects of having a premature baby? What does that do to the baby? I'm sure it depends on what week they're born, but what are some of the things that they might be affected with later on?
So one thing is they might not meet the developmental markers at the same rate that a term baby would, and that's something we really want to get out to mothers who've had a preterm infant. A lot of times there's special markers and times that are developed just for preterm infants. So they might have delays in meeting some of those markers. They might have chronic conditions like asthma. Some have issues with behavioral problems like ADHD, hearing problems, vision problems. Those are just some of the things that we can see in the long term.
And how long do the babies stay in the NICU once they're born? I'm sure it's past the 40-week mark.
Not always, not always. In fact, we usually tell mothers that the earliest the babies usually are ready to go home is about a month before their due date. Now that's pretty much if everything goes perfectly.
Wow.
If you have a baby that was, say, born at 32 weeks, they don't have a whole lot of maturing. Most of what they're going through is learning how to eat and grow and keep their temperature up. So they only have a couple milestones to achieve. If they're born significantly before that, say at 24 weeks, they've got a lot of other things to accomplish there too. So 36 weeks for those babies may be a little bit of the kind of the golden apple that you're trying to reach for. But oftentimes they're home between 36 and 40 weeks. There are some babies that take much longer than that, but it's very independent or very individualized.
And can some of that treatment be brought home with them? Can they continue the process?
Some of the things can be. You know, some of the earlier babies may need to be on oxygen for a while, and the vast majority of those babies will not need it after a period of time, and it's not a reason to keep them in the hospital if they're doing all the other things that they would need. So some of the things definitely can be brought home with them, and they can finish the maturing and development at home.
And while we're on the topic of gestational age, I do want to say that in the data we're seeing that a lot of preterm infants in Massachusetts are actually the more later preterm infants, so the 34-weekers to the 38-weekers. And we want to keep trying to move that needle till everybody gets to 40 weeks because not many families might know that in those very last weeks of pregnancy, the baby's brain goes through huge developments in density and in size, and we really want to try to get everybody to 40 weeks term.
And talk about, this month is all about premature babies. So what does the March of Dimes do this month to raise awareness and I'm sure raise money for this?
Yeah, absolutely. So we have a number of special events like signature chefs auctions going on all around Massachusetts, but you might also see some buildings lit up in purple, some prominent buildings for Prematurity Awareness Month. Actually, coming up very soon on November 17th, which is World Prematurity Day, we're going to be at Bay State Medical Center at Children's Hospital because we're launching a NICU family support program there.
Excellent.
And we're going to have former families come back and give gift bags to the current families. We're going to have press there as well. And then at 1 o'clock, we're going to Tower Square Court Center, and we're going to be highlighting the work of Project Baby Springfield. And they just made a quilt about all the acts of kindness that you can do towards mothers to reduce their stress, which is also a risk factor for preterm birth.
That is excellent. So Bay State is partnering with March of Dimes. Do you do a lot as well during the month of November?
Well, with these things, we've partnered with the March of Dimes. We have kind of an ongoing system throughout the year where we do various events with the families and so forth. Our kind of graduation ceremony that we have for the past year occurs in and around Father's Day every year, where we bring all the families or invite all the families back. And from the past year, and we even get some coming back from several years previous to meet the staff. It's always great to see how the babies are doing a year out. We remember them when they're this big, and then when they're up and crawling and walking and so forth. It's good to see how they progress.
A rewarding job,
Yes.
I'm sure.
Yes.
Sometimes scary, but rewarding as well.
Yeah, and we definitely want to celebrate all the progress that we've made. Can be a very daunting and sometimes difficult issue to talk about and spread awareness, but we also want to spread joy and celebration that so many babies are coming out with good outcomes, and we're really happy and proud about that work.
And it's because of the technology and the developments in medicine, I'm sure, and everything else that you both are doing in that field to make that happen. So thank you both so much for being here and sharing all of that insight. We really appreciate it. It was really interesting.
Thank you.
We'll be right back on 22 News in Focus, and we'll be switching gears to Alzheimer's disease. You're watching 22 News in Focus. November is also National Alzheimer's Disease Awareness Month. According to the Alzheimer's Association, more than 5 million Americans are living with Alzheimer's disease, and it's the 6th leading cause of death in our country. So joining me now to discuss this disease and what's being done to help patients as well as their caregivers are Marcia McKenzie, Director of Diversity Initiatives for the Alzheimer's Association Massachusetts and New Hampshire chapter, and Sean Hurley, C1 Unit Coordinator and Nursing Services for JGS Life Care. Thank you both so much for being here. Before we get into what Alzheimer's disease does to the family, because we know it affects a lot of people, could you guys talk about what it actually does to someone's brain? We know the effects, that we see, they forget things and stuff like that, but what does it mean for their brain?
Okay, so Alzheimer's disease is a progressive degenerative disease of the brain. So what it actually does is kill the brain cells, and where the brain cells die off, it leaves tangles that clump together and make a hole in the brain. So actually when doctors are doing scans of the brain, what they're looking for is a reduction in size, so that shrinkage in the brain, and they're looking for those holes, and they're also looking for formations of plaque in the brain.
And it wasn't before, this is pretty recently, that it was actually called a cause of death. Beforehand, it might have, someone had it, but the cause was called something else. So what does that, how does that change the understanding of Alzheimer's disease?
So what we know is that on autopsy is when they were years ago, able to see these changes in the brain. So they saw the shrinkage, they saw the plaques and the tangles in the brain, and then they were 100% sure that this was Alzheimer's disease. Those are the hallmarks of Alzheimer's disease. With new technology now, and with doctors and neuropsychologists who are really experienced in Alzheimer's disease, they can make a diagnosis 99.9% that it's Alzheimer's disease.
Wow. And so over time, that can obviously actually cause the death of someone.
Right. So before, it was things like maybe pneumonia or fall risks that would, make a person die, and so they weren't willing to put Alzheimer's disease. But now we do know with new technology that it is, and they're also looking at other things that present. So they're looking at not only just the memory loss, but they're looking at the loss of cognitive function, the brain not being able to use sequencing anymore, good judgment, things like that.
And how does Alzheimer's disease differ from dementia? Is there an obvious difference for people?
Well, it's a form. It's a broad term, which covers about 80 different processes. What happens with the residents that I work with? They're actively living in the middle to late stages, and like Marcia was saying, we see just cognitive loss, ability to eat, ability to reason, ability to know their loved ones, to take care of themselves. It cripples to walk, and the functions of the processes of the body just shut right down. Just our daily challenges of the ADLs, of the washing of people, the feeding of people, and the management of behaviors becomes our biggest challenge.
And you must see that it's a quick decline, right, after a while?
Well,
Or it can be?
It can be, and it's for families who come in on a regular basis, it's almost unnoticeable to them until it reaches those very, we'll say with some residents, aggressive stages where their personality just really changes radically, and then the families become very concerned. As we have an interdisciplinary team which looks at the whole picture of each person with the Alzheimer's disease, and many players to try and keep them with their skills, their cognitive skills, for as long as possible.
So you work with people who have had Alzheimer's disease for quite a while already? Or do you work with all stages?
Yes, I work with all stages, but pretty much middle to end stage.
Okay. And we think that Alzheimer's affects elderly people, but really it can start pretty early on, right?
Right.
How early can people get Alzheimer's?
So we see people in their 40s, 50s being diagnosed with Alzheimer's disease, but what the science is telling us now is that Alzheimer's disease can actually start developing even 30 years before we see it in a person.
Wow. So if they start showing signs when they're in their 40s, they might already
Right.
start developing it in their 20s?
So with that said, people in their 40s who have developed Alzheimer's disease, that's still very rare. That's considered very rare. The average age, the more common age, is in their 60s.
Okay.
For it to develop.
And so you were talking before about detecting Alzheimer's disease. What are some signs for people at home that are thinking, that didn't seem right. I forgot that. I forgot this. Maybe it's just a part of aging, but maybe it is a bigger problem.
Right.
So what are some...
So some of the signs, it's always the memory loss, but what we have to remember is it's memory loss that disrupts your everyday life, that prevents you from doing your daily task, your familiar task. So it's not just simply forgetting, it's the brain's inability to process information. So everything we do requires sequencing, right? Sequential tasks, brushing our teeth, making ourselves a meal. If the brain is no longer able to do sequential tasks, then that's a huge warning sign. Other things are not being oriented to time and place, difficulty balancing your checkbook, forgetting how to find your way home. So even if we lose something and then we find it later on and not recognize what it's for, then that's a big problem. If we don't have the ability to retrace our steps, then that's a big problem.
And that's the time that you should really start talking to a doctor.
Exactly. The minute you notice that something is not quite right, you really need to see a doctor.
And would that be your regular physician to start it off with, or who do you go to right away?
We always recommend your primary care physician, and then he can refer you to someone to get a more in-depth diagnosis.
Okay. We're going to take a break, and then I want to hear about the patients that you work with every day in particular. So you're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about Alzheimer's disease, its devastating effects on a person and a family. So from your perspective, working with people with Alzheimer's disease, what are some of the changes that they make, the changes in personality that you notice, and how does it vary from person to person?
Depending on how quickly the disease progresses or what stage that they're in, we see changes in their daily eating habits. Some people can still help with dressing, but as the disease progresses, as Marcia was talking about, those little bits of information that are transferred through the neurotransmitters, they break down, the cells die, and they can't get the whole message through, and they can't remember. So we have a staff that is trained in trying to keep the memory in the brain in its highest functioning capacity, and the way we do that varies with each individual according to the disease. But we use music, which triggers lots of memories, because you know, as we're growing up, we have our favorite songs, and we associate those with emotional aspects of our lives. And we use that for, instead of medication or until or coupled with medication, what that does is it can bring back pleasant memories. And we do extensive, through our admissions department, we do extensive history. What kind of music did your loved one like? So we put together a program with life enrichment, and we have individuals who cater specifically for these needs in our nursing home. It's incredible to be able to keep someone who might be declining rapidly less declining in the disease process through these simple tasks.
It must be amazing, like a light switch turns on, right, when they listen to this music and just...
I have seen residents in crisis with anger, and you would put an iPod in their ear with their selected music, and they would instantly calm down. No medications needed, and they would just relax and enjoy the music.
Wow. And why is anger something that's common among people with Alzheimer's?
We find that this part of nursing is so challenging because it's almost like the person is trapped within their skin, within their mind, and they could be in pain. They could have to, their bodies eliminate food, temperature, an infection process. They're trying to tell us, especially in the later stages, what's going on. And there's the level of frustration of trying to, if the ability is still there, to find words. And they're so trapped. And it's our job is to try to unravel all of these, the anger, the body mechanics. So for people in the later stages, the importance of continuity of caregivers. We really know this person, your father, your mother, so well that if the behavior comes, we know that something else is going on completely unrelated.
And they might not know you by name at the last stages, but do they kind of recognize you as someone they see every day and make that connection really deep within?
They do. On the C2 unit, there's the continuity of workers, and I've seen a resident just seem like they'd be drifting off, and one of the nurses' aides or life enrichment aides would come by, and you could see just that quick little glance that there's something familiar, where most of the things in their environment just aren't too familiar, but they do. They really do.
That's really interesting. So you were talking about medicine a little bit. What kind of advancements have been made in maybe stopping the progression, or how quickly Alzheimer's progresses in a person?
Right. So we have 4 medications on the market that control some of the symptoms of the disease. So like Sean was talking about, the anger, the paranoia, hallucinations. However, we are still in the process of trying to find a way to stop that buildup of the amyloid in the brain. That's where we are now with science. We're actually talking about prevention. They're actually looking at that amyloid buildup in the brain and what they can do to stop that. So that's where we are with science right now.
And you always hear early detection is key.
It's key.
Yeah.
Right.
What does that mean?
So early detection is key because first of all, it gives the person knowledge of exactly what is happening, because not all memory loss has to be Alzheimer's. It could be caused by something else, like a urinary tract infection. It could be depression. So there are other conditions that can mimic memory loss. So you want early detection. Early detection also gives you, the person, the opportunity to have a say in their future care, so they can be involved in advanced care planning. It also gives the family an opportunity to plan their future, financially, emotionally, physically.
It is a huge impact on the family.
Yes.
And families sometimes try to take care of the person with Alzheimer's at first. It's their loved one. Of course, they want to do as much as they can. But what are some of the struggles with doing that?
Right. So I think the biggest struggle is safety for the person with the disease and their overall well-being, and then family caregiver burnout is one of the big things. So if the family realize that, you know, they have to juggle the care of their loved ones plus their family's care, you know, if you're not living in the same household, then that becomes a huge burden on families. So at that point, usually at that point, they have to make a decision on the next level of care.
And people with Alzheimer's might not be far enough advanced to, you know, just go into care. They might still be fighting that, right? No one wants to live in a nursing home for the rest of their lives. So that must be a bit of a struggle as well, I would imagine.
Yes, definitely.
So when they come to you, you see them at all different levels of Alzheimer's. What's that transition like?
See, at our facility, when we treat Alzheimer's, you have to treat the whole family. You absolutely have to, because we were talking earlier, is that lots of families still think that it's, if they can just jog the memory, if they can just do something, that mom or dad will get better. So we find that education, most people know have been told that they're forgetful. They're forgetful, or mom and dad are getting old, and there's still possibly something that we can do to change that. So we try to educate them on the disease, and then they go through a lot of the processes themselves. They go through anger, denial, depression, and then when they finally come to acceptance, I think education is key. When they finally reach that point, say, okay, this isn't my fault. Mom or dad, they don't hate me. These words, because they'll be angry, they'll call loved ones names, and they really take it to heart. So education for us is a big deal.
And that must be difficult for you too. I'm sure you get called names and everything else.
We get called really beautiful names at times. And when I first started in this field in '88, I would even take it personally, because I knew very little at that time about the disease. And one minute I would, oh, hi, how are you? And the next minute I would be this tyrant, get out of my room. And I didn't understand it. And a lot of families come in with that same, I don't understand what's going on. We do get called names, but we kind of enjoy them, and we turn them around to
you have to have a bit of a sense of humor, because it's such a dark,
really
heavy topic, right? And
Right.
I think families probably feel the same way. You know, Mom, I know you didn't mean that.
Right.
What kind of advances in technology have been made to prolong life in people with Alzheimer's? Are there any yet, or is it still all in the research phases?
Maybe
reduce the advancements of Alzheimer's so that they're not, you know, degenerating as quickly.
Right. So that is still in research. I know that there's a lot of research going on. We have a lot of clinical trials. We on the Alzheimer's Association, we have Trial Match, which is a database that people can get more information on clinical trials. We don't have enough people going into clinical trials so that we can test all of these great drugs that could be or are promising. So we need more people to take that leap and find out more information about clinical trials. Until then, we're still, you know, have a lot of drugs in the pipeline that, you know, do show potential.
Interesting. We'll be talking more about that in just a moment, but first we're going to take a commercial break. You're watching 22 News in Focus. You're watching 22 News in Focus. This half hour we've been talking about Alzheimer's disease. It can be very difficult on families as well as the person with Alzheimer's. And this month is all about raising awareness about Alzheimer's disease as well as raising money for research having to do with medicines we've talked about or technology that may help people with the disease. Before we talk about what the Alzheimer's Association is doing this month, what are some other ways? You talked about music. Art, I heard, was another one. Are there other ways that people might be able to, remember things a little bit better or snap back into the person they used to be?
For us in the long-term care, it's really about getting as much information on your mother or father when they were at their highest functioning, that the things that they did in their lives, the activities they enjoyed. Our main focus, especially in the latter parts of the disease, is keeping all of their cognitive skills that they have at the highest level. We have things where it sounds simple, but folding laundry. I mean, just to keep the hands and the memory and the brain working and laying down as much information as we can. Activities, bowling. We've modified bowling with balloons and fun games that they would enjoy. Books on tape for those who really have difficulty reading. There are lots of ways.
Why is it that people with Alzheimer's and I'm sure other forms of dementia have still pretty good long-term memory, but their short-term memory is gone? Why is that?
Well, that's because Alzheimer's disease starts in the hippocampus, which is a part of the brain where your recent memory lies. So that gets hit first.
Okay. So they can still talk about times of old,
right,
but not
right.
what they had for breakfast that day.
Right, because they still have those memories are still in the file, in their file cabinet, so to speak.
Right.
But the hippocampus is where your recent memory lies, and it's almost like Alzheimer's disease opens up that file, and that's the first, opens up that drawer, and that's the first file they see, your recent memories, and it kind of goes in and takes that.
And then it slowly goes back
Right.
in time to delete them all, unfortunately.
Right.
Is Alzheimer's disease a hereditary disease?
So part of part of that is true. However, most of the Alzheimer's disease we hear about today is referred to as common Alzheimer's disease. The hereditary part, it maybe makes up a 5% of people with the disease.
So if someone has a parent who had Alzheimer's, they might not be at higher risk to have
Well, they are at a higher risk than someone who does not have a parent with Alzheimer's disease, but it doesn't necessarily mean because you have a parent with the disease, therefore you will get the disease.
So should they be doing any kind of screening early on in their...
So there is screening, but that has to be done in a clinical setting. So you couldn't just walk into your primary care physician and said, can you screen me?
And do you find that it affects different, like men more than women, or different ethnicities in different ways?
Yeah, so what studies show us is that African Americans and Latino are at a much higher risk for the disease. They have more risk factors. Women are at a higher risk. We outlive men. And the studies also show that people with lower levels of education are at a higher risk for this disease.
And do you find that that makes sense in your setting as well, or is it maybe not the same representation?
No, it's pretty accurate. I see more elderly Caucasians in my long-term care setting. But what I did like what you had spoke about there was the factors. And now they're including even high blood pressure can be a factor, diet, lack of exercise, which was actually news to me until recently. I didn't think those were contributing factors. So that hits just about everybody.
Right. And easy things that maybe you can do, not to prevent if you're already hereditary to it, but possibly prevent, I guess, right? Is that?
So we know whatever is good for the heart is good for the brain. So, lowering your levels of cholesterol, high blood pressure, controlling your diabetes, controlling obesity, smoking cessation, all those things. If you can manage those things, you have a better shot of keeping your brain healthy.
Makes sense.
Right.
So what is the Alzheimer's Association doing in the month of November, and what are some major milestones perhaps that you've done to help in the fight or against Alzheimer's and research?
Right. So in the month of November, we try to get the word out about the warning signs of this disease, and we try to kind of rally the nation to become advocates and ambassadors for us, because we need ambassadors to advocate on a local and a federal level. We need people to spread awareness for us. We need people to help us fundraise so that we can fund these clinical trials. Actually, this week we got news from the Centers for Medicare and Medicaid Services that they've made a decision to pay for cognitive and functional assessments for people in the early stages of Alzheimer's disease, people with mild cognitive impairment. So they can access services from a professional that will be paid for. And that's crucial in the life of someone diagnosed with Alzheimer's disease, because care planning means everything. That is one way that you can kind of take control with this disease when everything else is kind of beyond your control. So having that in place and knowing that that can be paid for is really a critical milestone for us. We've been advocating for that for years.
Wow. Well, congratulations on
Thank
that.
you.
And you have walks, Alzheimer's walks.
Right. Our walks just passed. Usually September is our walk season, and that's our biggest awareness event and fundraising event.
And with all of that money, does it all go toward research?
No, so it goes to programs and services, and it goes to research, because as an association, we do support advocacy and education. So all our community education programs we do at no cost. We have support groups. We have a 24/7 helpline. We have private care consultations for families at no cost. So that's where our money goes.
And it's a nationwide, or is it worldwide association?
So the Alzheimer's Association here is nationwide, but there's also a World Alzheimer's Association.
Okay.
So,
and the money that people donate, does it stay locally or does it go to the whole organization?
so we are a national organization, so it benefits every single Alzheimer's chapter in our nation. So like we have, our chapter is Massachusetts and New Hampshire, and we have regional offices across the state and New Hampshire. So the money raised here in Massachusetts and New Hampshire support our services here, but it also supports research, which we do research across the nation, and we support worldwide research efforts. Our biggest worldwide research is the A4 study. That's where we think that a cure is going to be found. We're really having exciting news coming out of that research. So the money nationwide goes towards that.
That would be excellent, and I'm sure you both would agree that
Yes, yes.
people are affected by this, whether it's a family member or a friend who has a family member.
Yes.
Almost everyone is affected in some way by Alzheimer's disease.
Sure.
Thank you both so much for
Thank
being
you.
here
Thank
and
you.
talking about this important topic. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been discussing two important health issues that face the very young and elderly: premature births and Alzheimer's disease. It's part of November's Prematurity Awareness Month and National Alzheimer's Disease Awareness Month. Remember, you can watch the whole program on our website, wwlp.com.